our patient, remember the narrow, the crowded one, we did an upper expander on her, a lower expander, and a couple upper braces during the stays just to get this out of the way. This is her in retainers. So this also, sorry I didn't put this in, but this is called a lower lingual holding arch. You'll see this a lot. This is it's like the lower version of the Nance for the top. It's a band around the 6-year molars and a little wire that basically just holds the width that we got and holds the arch length so that as teeth come in, the lower molars don't drift forward and take up any room that we need for teeth. So for her, what I really want to show you is the bottom. We did not use any braces on her. We just expanded and made more room. And this was her before. This is her after.
Wow.
Yeah, so what I say to people is the goal of phase 1, there are a lot, but in terms of dentally, it's developing the arches so that the teeth come into approximate the right spot and that their time in braces later, if they do need braces or Invisalign or whatever they're going to do, is going to be quicker, it's going to be easier, it's going to be less invasive because I will say that almost never when we do a phase 1 do they need to have permanent teeth taken out. So when I was in residency, it was like you see a kid when they're older and they are crowded and you take 4 teeth out. You take upper, lower, lower. And a lot of orthodontists still treat with a lot of extraction. It's very common. You'll see it a lot. You're going to have to tread lightly on expressing any sort of judgment for this treatment plan because a lot of orthodontists still treat this way. In residency, they said when you have an open bite, you treat it with extractions, which as we all know, really not ideal for a lot of reasons, and it's probably going to relapse because mostly the open bite is due to some sort of oral habit.
That was one thing I took from our myofunctional class this summer, because I had extraction, so it was interesting to me. But that they really focused on expansion because even though you're taking those teeth out, you think you're making more room, you're not giving your tongue a home to create that perfect arch, and that was something in the myofunctional point that I took.
Yeah, it's a kind of what I thought was really interesting was that Joy Muller lecture, she showed a skull of like a prehistoric, like a caveman. And if you go back to how caveman did everything, like cavemen did not have malocclusion. They had room for all their teeth. They had room for their wisdom teeth even. Well, why? Well, there's reasons why, and what she was saying about the chewing and the musculature and all of that. But when you think about something now, being very crowded is considered normal. Well, is it normal or is it just more commonplace? It's just more commonplace. So is it normal to need to have 4 teeth taken out of your mouth? Like, no, cavemen were not taking teeth out to make their teeth straight. So there's a reason why, and it's like what we're trying to do is go back to the beginning and ask, like, why are these things happening? And if we can pinpoint that, maybe we can reduce the amount of time that we need to do these invasive procedures later. And so that's really the goal and why we get so excited about it. And this is our friend who is the class 2.
So sorry about that.
That's okay. The class 2, we treated her with something called a twin block appliance. It is a removable appliance. This is one of many appliances used to treat a class 2 in a growing person, but it is, in my opinion, it has the least amount of like side effects of any other orthodontic appliance. It's just really bulky and it's getting kids to use it. Kids around this age, like 7 to 9, are the most compliant they're ever going to be. Once a kid gets older than that, I mean, maybe a younger kid is compliant too, but once they're a tween, like, you're not getting them to wear something like this to school, no way. And something like this has to be worn for a year, full time, but it is an amazing appliance. So it's on the top, you have like an expansion screw. On the bottom, it's just like a little retainer. How it works is that there are 2 like blocks of acrylic, and when they go to close their mouth, it's making it so that they have to close their mouth into a more forward position. So this, like, if anyone's familiar with a sleep apnea appliance, this is basically like what a lot of sleep apnea appliances are based off of, because it repositions the lower jaw forward, it takes the base of the tongue forward, and it puts it in a more forward position. So like a twin block basically is a sleep apnea appliance, just been used as for orthodontics, growth appliance it's called, for years.
When the twin block comes out, they've habitually now gained that position, which has
Right.
increased airway. And
Yes, and there's a lot of debate in the orthodontic community as to what's going on here, because what we're taught is that you cannot make your lower jaw any longer than it's going to be genetically. But what I think is going on, and you can weigh in, Dr. Koval, is that when you use an appliance like this called a functional appliance, it changes the actual function or the orientation of the jaw in space. and it repatterns the musculature, so your muscles get used to having the jaw in a more forward position. And then as an orthodontist, you can take the teeth later and make them like fit together in that position. And it's basically creating a habit where their lower jaw is forward.
Form follows function.
Yeah. So,
Do you use this as well? Or not as much?
Yes, but just like Dr. Goodman said, it's the compliance.
yeah.
We're more, I think both of us also, there's another appliance that's permanent so that you can't take it out, so.
What's that one called?
She uses, it's called a crossbow.
Crossbow. Oh.
Yeah, there are a few other appliances that you can use when a kid is older and in permanent dentition that you'll probably come across. One is called a Herbst. It's glued in and there's rods and it'll reposition the jaw. I don't love it because it does some things to the teeth, like tips the lower teeth. There's another that we use called the Crossbow. I'm not going into that right now, but there are other fixed appliances you can use when a kid is older. But anyway, this is our friend. She wore this for a year. She was really good. I just wanted really to show you the profile and how it's changed. Her lower chin is really back. Now it's not so back. So, great. And then I sent her to Jennifer. You've seen her, or maybe Emily has.
I'm waiting for her to
Yeah, she's not.
call.
This is our other friend, our class 3 friend. Really, I think like the gold standard of class 3 early treatment is with this face mask headgear. Usually he came later, but usually this is ideally used. The younger the child is, the better. I usually wait for the 6-year molars to be all the way in. So usually a kid is like 8 years old and I'll do this. And they have an expander. This headgear is like a rubber band, hooks up to the expander, basically just brings the upper jaw forward without any other side effect, any effect to the lower jaw, just bringing the upper jaw forward. And I will usually have them wear this 8 to 10 hours a day. This usually corrects in about 3 to 4 months in a kid this young with good compliance, and then that's it.
Summertime appliance, right?
What, so the one my son had, it like fits his whole face, it looks like, and it bothers him on his cheeks. That would be much better. Are there different ones?
I'm sure there's probably
I
5 different,
gotta take a
depends on the
picture of
lab
this.
that make, this is the,
Yeah.
what I think is like most people use
right
this.
here.
Yeah.
Square?
Yeah, his is like square and it hits his cheeks, so then he complains about it hitting.
The bars coming down
Yes.
the side.
Oh.
That's-
This is less intrusive.
That is, yeah, that really is.
Yeah, and you
I
know,
gotta
kids actually in
tell
that
him
age
to
do
let
great
me
with it.
This one is nicer because the chin part slides up and down the bar. The one that you're talking about, when I was in my residency, would use that whenever they would open their mouth, the whole thing. would
Oh, yeah,
open
it's
up.
horrible.
So,
And when he sleeps, it comes off and I gotta find that.
I can tell you where we get it.
okay.
We'll find somebody, but that's much better. And this is our friend at the end. He did have a couple braces too, but this is.
Oh, wow.
Yeah, and so the thought is that you correct the anterior bite, you make space, you send to the myofunctional therapist to make sure it stays like this. And our hope is that his growth will just continue in this way if the soft tissue function is proper.
And his airway is thanking you.
Yes.
Now, does he have to wear a retainer for the rest of his life?
That's a great question. So we do have people wear retainers, but retainers, all they can do is hold the alignment of your teeth, like make sure they're straight. They do not retain your bite. So, for all intents and purposes. So, that's why a lot of our patients who have relapsed, they've worn their retainers. I actually do a lot of fixed retainers, just like glued wire behind the teeth, and they still relapse because of there's some sort of tongue issue. If they're going to relapse, it's because of that. So we still tell people that retainers are for life, but I tell people that they can really only hold the alignment of your teeth and not hold your bite where it is, because you're dealing with growth and you're dealing with
So your
all the
teeth
those
should
extra
move
oral
if you
forces.
wear your retainer, is that what you mean?
The actual physical teeth, like the
Right.
alignment of your teeth. Yes,
Okay.
exactly.
Okay.
But everything else, we don't have. We can't control that.
So it won't hold the jaw
No.
collapsing.
It won't hold the jaw. It won't hold. Because again, as you're saying, it takes like very minimal force to move a tooth, and your tongue has way more force than the amount of force it needs.
Okay, I just have a question.
Yes.
I mean, I had braces as a kid, and so did a lot of other kids, and we didn't have to wear our retainers forever, whereas it seems like now a lot of kids they wear their retainers forever, otherwise things shift.
Right.
What's
now-
the difference? I mean, because my teeth never shifted. A lot of people I know, their teeth didn't shift.
You're lucky.
Oh, okay.
I see a lot of parents of patients who their teeth have shifted. So now we tell people they have to wear the retainers forever.
Okay, mine haven't.
I mean, I would love to do this long-term study about how, like, if their tongue's in their proper
Tongue is
position and
in
everything,
right.
like maybe we can
Maybe
get rid of,
that's
like,
why,
one.
okay,
Yeah.
maybe that
But-
affects the shifting, okay.
But, well, there used to be thought, well, if you take your wisdom teeth out, I mean, there's thought about wisdom teeth and this and that, but they've done, there's like a hallmark study in orthodontics that, like, whether you've had extraction or not, whether you have wisdom teeth or not,
Okay.
your teeth are gonna shift no matter what over time. So you're
Okay.
going to wear a retainer to hold the alignment. So that's the current thought, is that retainers are for life, so.
I guess I never got wisdom teeth, so maybe that's why they
No, your tongue, you
yeah.
probably just have proper tongue position.
Okay.
And then
Thank
just
you.
the